Good day and welcome to yet another in a series of interviews that we're conducting on behalf of Beautiful Plains Community Foundation. I'm Ken Waddell of NACTV, and today I have with me Jocelyn Scheper, who is the Neepawa Health Center Care Team Manager. That's a mouthful of a title, so welcome, Jocelyn. We're here to talk about your organization, which is really our organization, obviously, here in Neepawa, and the Beautiful Plains Community Foundation. So tell us just a little bit about Neepawa Health Center.
So Neepawa Health Center, we're a 38-bed unit that is located in Neepawa, the town. We have multiple services that we offer at the Neepawa Health Center. We do palliative care, we do maternity services, we have an active ER, our outpatient department. We also do care for a surgical program that we have running at the hospital right now, and just a multitude of services that we offer. We also do med-surg beds and acute beds as well. So we have multiple departments that we continue to run from the hospital.
So one of the things that we exploring with the various organizations is the value or impact of the organization to the community. I don't think we have to spend a lot of time on that because everybody knows that the Neepawa Health Center, Neepawa Hospital is immense value to the community every day, 365 days of the year. Mm-hmm. But the hospital has had substantial donations before the foundation even came along, I think, but tell us how it all works. There's some grants come through the foundation, and then you have the Sayward Foundation grant as well. So tell us how all that works for the hospital.
Okay, for the Neepawa Health Center, we always have, we haven't ever applied for grants from the Beautiful Plains directly, but the Sayward Foundation has been set up, and it is managed by the Beautiful Plains Committee. The Sayward, Mr. Sayward was a fellow who passed away a number of years ago, and he left a substantial donation to the Neepawa Health Center, and every year we get the interest of that donation for our hospital. So it provides $40,000 to $50,000 every year that we can spend on equipment in the site. So it's a huge initiative for our hospital. It's an excellent resource that we have. If we didn't have that resource, there wouldn't be the amount of equipment that we have. We wouldn't be able to meet the needs as well as we do.
So I remember one of the, I think I was taking the picture or something, I can't remember. One of the things that was bought a number of years ago was a portable ultrasound machine. Yes. And I think you're still using maybe a replacement of that one now, but using that. But what other kinds of things have you spent the money on at the hospital that come to your mind right now?
Right. I do have a list of some of the different items that we've purchased because there's so many, I wouldn't be able to remember them all at once. So for our surgical programs, we've purchased a CO2 insufflator that we use for our endoscopy surgeries. We've got a septo set, multiple items that we've used to promote for the ENT program that we've done surgery with over the years, multiple sets in order to do those types of surgeries. We've purchased vital sign machines for our acute floors, Broda chairs, commode chairs, high back patient chairs. We've bought bedside tables, commodes, as I mentioned, specific beds for palliative patients to make that change the air pressure in the beds. We've been able to purchase that. Cast cutters. We've also purchased a difficult airway intubation SI imager, and that helps with difficult intubations in a pinch and outpatients and in the operating room as well. Okay. So, good. And also labor and delivery beds for a maternity program, phototherapy equipment, and a gynae stretcher. So.
Okay. Well, thank you very much. That's an extensive list, and unfortunately we only have a few minutes here with each interview, so thank you very much for telling us what has been done through the foundation and through the Sayward Foundation. This fall, folks, if you want to give to the foundation, I'm sure they'd be happy to hear from you, and so we thank Jocelyn for coming in today to explain one part of the program, and I'm Ken Waddell for NACTV. Thank you very much for being with us.
Thank you.